Hey, it's Dr. Jarrett. How you doing today? It's 2 Cents Tuesdays. It's 1 o'clock every Tuesday. I'm here to talk pediatric topics with you every week on Tuesday, Facebook Live, 1 p.m. Eastern. Glad you guys could join in today. A lot of things have been kind of in and out of the news, particularly recently. However, not a lot that's really been stand out that I really want to bring to you as a breaking news story today. But as always, make sure you're paying attention to my feed, my Dr. Jarrett Facebook feed. There are articles almost on a daily basis of something that a journalist may be asking me or questions that have been out there and they're putting in their own publications. So there's all types of stuff. Been a lot of baby development things in there lately. So any of you guys out there with babies, make sure you're paying attention to that. Anywhere from cruising to walking to talking to cooing. A lot of articles like that recently. So make sure you take a look at those. Probably the biggest news, which is big on the East Coast at least, is really people are worried about another nor'easter after we got hit pretty heavily by one last week. We're coming right back with another one, which is in March. You know, sometimes we get these late season storms here. I know some of you guys in the South were getting a lot of thunderstorms and maybe tornado watches and things like that, which is really kind of spawned my discussion topic for today, which is about allergies. So we'll get into that topic in just a little bit, but I wanted you guys to really think about the concept of what's going on across the country as far as the different weather patterns that are going on and how that may affect allergies. Hey, Mariana, thanks for joining in today. So for one of the biggest things that I will say is that we are going to be starting season 2 of 2 Cents Tuesdays with Dr. Jarrett. A lot of you guys have seen my post on Instagram and on Facebook soliciting different questions, things you want to see, things you want to hear about. So again, I'm here for you. I want to give you, the viewers, what you want to see. So a lot of people have given me some great ideas. Maybe even I've run into people in and around town that have given me some, but lots of good posts. And I'll maybe send those posts on one more time because we are just about ready to get season 2 started. I thought about giving you guys a couple of weeks of reruns, but of course nobody likes reruns, at least for 2 Cents Tuesdays, because they can get out of date for a while. But if you want to see any of the 2 Cents Tuesdays and you can't find them on my Facebook page, you can go to my YouTube channel. They're all housed there as well. So I am Dr. Jarrett. I'm your board certified pediatrician and here to help you take better care of your children, their better behavior and health. I'm doing this through my books, my live streams every Tuesday on 2 Cents Tuesdays, and other programs I'm going to have coming out very soon. So toward the end of the spring, you'll hear some good announcements coming your way of things that I'm going to be bringing to you, which really will help you with your kids. All I want you to do is make sure you're sharing this video and liking my Facebook page. And again, I'm here for you guys. If you don't need some certain topics, then we won't review them. But if people really want to have some of these new topics, they've been giving me some great ideas, and it's something I have to bring to you guys. So you'll be there for sure. So let's talk about seasonal allergies. Seasonal allergies tend to happen in seasons. So people think about the allergies, whether they're happening in the spring season or summer or fall, and we're beginning the spring season in a lot of areas. And so when we talk about my viewers down south, you guys are already probably starting to see a lot of those allergy symptoms kick in because, well, stuff is already starting to bloom and blossom. The pollens are out from the trees and in the grasses. And you guys have a shorter winter, so things are already starting to kick up. Here in the Northeast, stuff is still kind of brown and dead, and there's no leaves on the trees yet. And like I said earlier, we're going to have a snowstorm again tomorrow, so nobody's really thinking about spring allergies. However, the reason I bring this to your attention now is because this really needs to be on your radar now. If you have children that attend school or daycare and they tend to get seasonal allergies, you may notice that their symptoms are worse at different times of the year. Some kids have allergy symptoms like runny nose or itchy eyes or maybe even cough that go on throughout the year. Some have it worse in the spring, some have it worse in the fall, some maybe have spring, summer, and fall kind of allergies, and then they get a chance to calm down over the winter break. But the reason I'm bringing this to you now is that it is just about the time when those allergies will start kicking back in the Northeast, and it's always easier to treat them if you get a head start on it. So we'll talk about that in a minute. Allergies typically this time of year are caused by tree pollens and some grass pollens that are out there. The trees are beginning to bud and bloom, and it puts a lot of pollen in the air. Quite frankly, down south, I'm pretty certain that many of you guys may be already starting to suffer with your allergies, and you're getting these runny nose or itchy throat or itchy eyes, maybe even a cough. And remember, asthma runs in the same family as allergies, so there are some other things that could be in there that could cause you some allergy problems. So you're going to want to make sure that if your child does have asthma, the allergies and these seasonal allergies can kick up the asthma symptoms. So you're going to want to make sure you have your refills on their rescue inhalers or their nebulizers, and make sure they're taking their everyday meds if they're on everyday meds. So remember, one thing is to take care of the asthma and be prepared, because typically when these allergies start to come, they come right out the box, and it starts with the little runny nose or itchy eyes, and then it goes from there. If your child tends to have these allergy symptoms that come around every year, you know what their symptoms are. You know what you've treated them in the past. Probably don't expect anything different. Unless they're on allergy shots or immunotherapy of some sort, they're probably going to have the same symptoms again. And maybe as they age, they don't get as bad as they did before, but they will have these same symptoms. So there are a couple categories of medications that are easy to treat, and the time to treat them is right now. When you look at things that will block the immune system from reacting to these substances, the substance that's released in your blood is called histamine. The type of medication used to treat that are antihistamines. So you are looking at your common names of these antihistamines. Could be something like Benadryl, which tends to make kids sleepy. Some of the newer antihistamines like Claritin or Zyrtec are the trade names, and they tend to not make kids as sleepy, and they calm the histamine reaction down. So particularly if your kid has a combination of symptoms, maybe runny eyes, a little bit of itchy throat or itchy eyes, then a histamine may be very good for that. For kids that just have a runny nose primarily, there are nasal sprays that are made with corticosteroids that actually can calm down the nasal symptoms and reduce that runny nose. So some parents will opt to starting those type of medications, and they're also safe for the use in children. They don't tend to have systemic side effects. People tend to get nervous when they hear about steroids, but these nasal steroids are actually very safe, and they've been studied in kids, and they tend to calm down those symptoms. And then you have the same type of medications that can be used for the red or itchy eyes that come along in this time of year. And the eye drops, sometimes they are histamine based, sometimes there may be steroid or a combination of other types of medications. But if they have primarily itchy eyes over the time, you may just want to stick with eye drops. But many kids have a combination of the three, and you may want to start a combination of all of those medications. Some kids do need the oral medication with the antihistamine. They may need the nasal sprays in addition, and they may need eye drops in addition. So you know your child the best. The reason the topic is even coming up today in lieu of a snowstorm on the East Coast is it will only be a couple of weeks after that you'll start seeing these symptoms. So you want to start the treatment ideally 2 weeks before the season really begins. So on the East Coast, the season is going to begin in another month or so. So that's why I want you guys to start making preparations, getting all of the asthma medications, getting all of the allergy medications ready. You can maybe even call for refills at your doctor's office if they need those as well. These are all things that will help the child get through their symptoms a little bit easier, simply because they will have some time to let the medicine kick in so their allergies don't come on full bang, and then you're kind of chasing the allergy symptoms, trying to get them to calm down. So if you can start them ahead of time, a week or two before the symptoms really are due to start to begin, you're going to be in better shape. So this is just a courtesy reminder for all of you guys. Hey, Dr. Centrell, thanks for joining today. A courtesy reminder for all of you guys to just know that allergy season on the East Coast is going to be coming soon. You guys are already starting to see it in the South. I know that. And some of you guys out West as well. After you get on the West Coast primarily, in the mountains, you're still getting lots of snow. But Midwest, sorry about that. I had an interruption here. But as a result, make sure you're getting your things taken care of and getting them all together. You will be ready to go very, very, very soon. That is really my reminder for this time. Season 2 is beginning very soon, so look out for that. It's going to be a great season. We have some great topics lined up. We may even have some guests as I get on the road to a few different places. We'll have some things for you to keep you guys engaged, and I want to continue to engage with you as well. So make sure that you guys are giving me the topics you want to hear about for Season 2, and we'll be getting to it in just a couple of weeks. So as always, thanks for tuning in. I am Dr. Jarret, your board-certified pediatrician, here to help you parents out there take better health and care of your kids, particularly in the behavioral challenges you'll be having. And I'm doing this through my books, my programs that I have forthcoming, and 2 Cents Tuesdays, which I have every Tuesday for you guys. So like my page, it's at Dr. Jarret. That's spell out Dr. J-A, 2 R's, E, 1 T. And we will see you guys next week, 1 p.m. Eastern. Take care.